Hi, I'm Samantha Benham-Hermits, Director of Policy and Public Affairs at Alzheimer's Research UK. I'd like to start by saying a huge thank you for your continued support for the vital work of Alzheimer's Research UK. We need you by our side now more than ever, because COVID-19 is creating huge challenges for people affected by dementia and for dementia research. The virus is affecting all of our lives, but unfortunately we know that people with dementia seem to be some of the hardest hit. Official figures show that 25% of people who died from COVID-19 also had dementia, and that people with dementia are dying in greater numbers than before. We need to do everything we can to protect people with dementia, and research gives us the best hope of being able to do this. So while things have changed, our researchers wanted to show you how they've adapted to the new normal and what this means for the future of dementia research.
Like many of you, a month ago I had to swap my desk in an office for one in my spare room. This is where the analysis, writing and collaboration now happens, as well as teaching the next generation, namely my 5-year-old daughter. Dementia researchers everywhere are adapting to keep the research going. Many are also contributing their skills directly to the pandemic response, caring for patients or boosting diagnostic capacity. As you can imagine, it's all hands to the pump in the NHS right now. So I'm one of many being recalled to my day job as a public health trainee. So from the same spare room, I'll be working for the NHS and Public Health England, providing specialist support to health and care services, including care homes dealing with outbreaks of COVID-19. These are difficult and anxious times for everyone, but we will get through this. Hopefully, with a new belief in public health and in the duty of society, not just individuals, to act to promote and protect people's health.
Hi everyone, my name's Selina Ray. I'm an Alzheimer's Research UK Senior Research Fellow. Like everyone, I'm working from home at the moment. The lab is locked down. However, today I'm on my way to the lab for the first time in 1 month, and the reason for that is that I have key worker status. There are several of us in the lab who have that. Well, there are key pieces of equipment that we need to keep working throughout this lockdown period that look after, for example, our cells that are incredibly precious. They take years to generate and we don't want to lose them. So myself and others are going in just to check that everything is as it should be. I just got to the lab, as you would expect. It's completely empty. I'm just going to put the lights on. So first of all, I'm going to go into our cell culture and just check that everything is kind of safe. So you can see that one lab we've completely shut down, but the other lab still has some very long-term cell cultures in. So these are cells that we've had in continuous growth for over a year, so we're still trying to keep those alive. So all I need to do is check that these things, which are the incubators, if you can see that, are still switched on, and that their kind of temperature and everything is fine. I've done all the checks in the lab that I need to do, so I'm leaving work now to go and continue working from home. It's always quite sad leaving. We're all missing being in the lab, but I think I'd probably just finish by reassuring everyone that we're still all working quite hard. So even though we're not physically on site, we still have papers to write. We have a lot of data that we've generated in the lab that we can now analyse from home. So we're still really working incredibly hard, and we're getting a lot done. We're just all looking forward to being back on site. So please take care, everyone, and we'll see you out the other side of this. Bye.
My name's Dr. Claire Durrant. It's currently 7 AM and I'm here back in the lab after 3 long months of working from home from my computer. It feels absolutely incredible to be back in my natural habitat amongst our incubators, amongst our sterile tissue culture hoods, and really getting back into the practical experiments that we need to complete. Thank you so much for your support throughout lockdown, and Alzheimer's Research UK and Race Against Dementia really appreciate people like you who stuck by us in really difficult times for the whole world. The new normal is going to be weird for a while in science. As you can see, it's exceptionally quiet and I'm here really early. So really, we're making sure as a university and as a charity that not only are we protecting our research by being careful, but obviously we're protecting the people that drive it, and we're making sure that our future with a world free from dementia is well within our grasp.
My name is Daniel Erskine and I'm an Alzheimer's Research UK Fellow at Newcastle University, and I'm really concerned about the impact of the coronavirus situation on dementia research. Of course I'm concerned about my career and I'm concerned about the careers of my colleagues, but what really worries me is the impact that this will have on the tremendous progress that we're making in dementia research. I've been amazed at the progress that's been made, even in the relatively short period of time that I've been involved in dementia research. And I'm so excited to see where we will go if we continue on the trajectory that we are currently on, the impact that this will have and the difference that this will make to people affected by dementia. But the problem is, the majority of research into dementia is performed by early career researchers, the people who are most likely to lose their jobs as a result of the coronavirus situation. And this is not just a loss of manpower, this is a loss of valuable expertise that's been developed over many years of training. So I'm concerned that the coronavirus situation may slow down the development of life-changing treatments for people affected by dementia.
In the area I work in, it's our role to hold the government to account on its commitments to dementia research and to keep dementia research a national priority. COVID-19 has become the government's top priority, and rightly so, and this has meant we've had to adapt how we work too. Over the summer, we joined with 300 dementia researchers to write to the Science Minister and warn her about the impact of financial difficulties faced by universities and medical research charities and the potential impact this could have on early career researchers, people who are just starting out in their career in dementia research. We cannot afford to lose a generation of new dementia researchers. We're calling on the government to continue with its election promise to double the dementia research budget. This investment is long overdue and will make a huge difference. As you can see, dementia research is facing considerable challenges, and the progress we've made over the last decade is at risk. But the need for a life-changing treatment for dementia has never been greater, and we will not give up until we achieve this incredible feat. While we're facing a fall in income of 45% this year, we will redouble our research efforts as soon as we possibly can. And this is only possible thanks to the fantastic supporters we have in people like you. Together, we will transform the lives of everybody affected by dementia. Thank you.